The United Nations has warned that Sudan's ongoing civil war is pushing the country closer to catastrophe and that essential services are in danger of breaking down. More than 12 million people have been forcibly displaced since fighting between the National Army and RSF paramilitary forces broke out in 2023. The conflict is currently the world's largest displacement crisis. Around 4 million people have fled to neighbouring countries, including Chad, South Sudan, Ethiopia and Egypt. Last week, Sudan's government rebuffed a peace proposal put forward by the US, Saudi Arabia, the United Arab Emirates and Egypt. Well, Abdouraouf Gnon Konde is Director for West and Central Africa for the UN High Commissioner for Refugees. He can help us understand how this conflict is affecting neighbouring countries. Welcome to DW, sir. I mentioned in the introduction that 4 million people have fled to neighbouring countries like Chad, South Sudan, etc. What sort of impact is refugee numbers on that scale having on countries that quite often already have their own problems?
No, you're absolutely right. And thanks for having me this afternoon. It's clear that when you look at a country like Chad, Chad has received since April 2023 close to 877,000 new Sudanese refugees. I'm saying new because since 2003, this is a country that was also home for close to 420,000 Sudanese refugees.
Right.
So, and then our planning figure for this year is that Chad will probably reach 1 million new refugees, Sudanese refugees. And you are also right when you were saying that those countries like Chad has problems of their own. So you can imagine in that fragile eastern part of the border between Chad and Sudan, how Chad will welcome, receive, install, provide humanitarian assistance to close to 1 million new Sudanese refugees.
Well, tell us how that works, because in any country, that number of new arrivals who are desperate is going to be a challenge in a country that is already suffering. That's a problem. So how does it cope? What does it have to do?
I mean, it's a challenge, as you were saying, because, I mean, just to give you an example, there is a small border town which is called Adre, an entry point between Sudan and Chad, which used to be home for 40,000 individuals, which now host close to 270,000 individuals. So you can imagine, and those who come, in majority, are women and children. So how do you deal with the needs of those newcomers if the country like Chad is not supported? As a matter of fact, today in the eastern part of Chad, 1 in 3 persons is a refugee. And if you take the whole country, 1 in 14 is a refugee out of a total population of 17 million individuals.
So as you say, that's a major challenge. I wonder how refugee numbers are on that scale. How does that impact a country's domestic politics? We have seen here in Europe, we have seen in South Africa when refugees are coming in, how that changes the political landscape. How does it affect countries in the region?
You will be surprised to hear that a country like Chad, despite the challenges, despite the challenges that comes with hosting that massive number of refugees, has deliberately equipped itself with a progressive legislative framework to provide access to services, to provide lands to those newcomers, to even trying to see exactly among the new refugees who are nurses, who are lawyers, who used to be civil servants back in Sudan, how Chad can benefit from those skills and see exactly how it can use it in its own administration. So this is progressive. So we are far away from some toxic narrative where...
That's very interesting. Why do you And so why do you think that is? Why has Chad, for example, been able to absorb such high numbers, such massively high numbers? As you say, they're a significant part now of the population without it causing domestic strife?
I mean, they said it themselves. I remember I was on a mission with the High Commissioner in April. We met with some officials, including the head of state, and then all of them were saying that, we have to do it because those are our brothers and sisters from the other side. So today that the country is going through that kind of turmoil, we cannot, look away and close our border. We need to open the borders. We need to make sure that they come. But of course, it comes with they need to be supported. And this is why I'm using this opportunity to say that the whole international community need to make sure that we continue to support a country like Chad that has progressive legislative, that has the will, that is so generous and hospitable to make sure that it can continue to host all these, massive numbers.
And this goes beyond the government, does it? Because again, if I can use the German example, we back in 2015 we had a government that said we'll handle it, we'll deal with it, and in came more than a million refugees, and it changed the domestic conversation. So the government had one idea, the population was and still is much further behind in this. You're talking now about Chad, where the government has similar progressive ideas. Are the people behind them?
People are behind it. People are the one providing lands. People also understand that maybe, despite the challenges, it comes with an opportunity to really see beyond life-saving how those people will be included in the socio-economic fabrics. And this is where it's important for all of us to understand that without proper, adequate investment in education, in health centers, making sure that access to natural resources like land, I was just mentioning, doesn't create competition. And for us and for the government, it's critical that we don't just look at the refugees. So we need to deliver our intervention in a way that we also take care of the Chadians who also struggle with the same challenges. So how do we do it in a peaceful and social cohesion, manner that give the feeling to the Chadians who are also struggling that it's not just about refugees, but it's also, they are not forgotten.
Meanwhile, the World Food Programme is warning that it may soon have to halt refugee aid because of a lack of funds. What will happen to these people, to these refugees then?
I mean, it's an issue of concern for all of us. It's not just WFP, it's all of us, because we are now experiencing a level of cuts or reduction, up to the level of 50%. For the majority of the actors, for UNHCR is around 25%. And then we see the consequences, immediate consequences in terms of health. Let me just give you an example. The health sector, for instance.
Very briefly.
Today, you have one doctor for every 50,000 refugees. You can imagine how that comes with an impact.
Thank you so much for talking us through that so clearly. Mr. Abdouraouf Gnon Konde of the UNHCR. Thank you so much.
Thanks a lot. Thanks a lot.